Today on At Your Service, we will be discussing cannabis and vaping. Stay tuned. Welcome to At Your Service. Today we are discussing cannabis and vaping and the impact that they have on students and schools. And with us today we have two special guests. So if you all could just introduce yourselves, give us your name and your positions.
Yeah, hi, I'm Karen Siska-Creel. I'm the Director of School Health Services. I oversee all the healthcare in the schools, over 86,000 students, and the delivery of school health services, which is first aid and care coordination, just removing all health barriers to them, accessing their education.
Awesome.
I see 350 staff that we have in the schools, so yeah, it's a lot.
It is a lot.
Great. So I'm Isha Alston. I'm the Deputy Director of School Health and Support, and I assist in the oversight and supervision of our school health program as well as our support services.
Great. So what brought you both into this role of school health?
Well, to be honest, it's a great mom job. I mean, you know, it's like teachers, you know, you're off when the students are off, you get to be home, holidays, weekends, and as a nurse, there's no nights, no holidays, and no weekends. Right. You don't have to find coverage when you need off. It's very friendly. It just was great. And then once I got into it, about 2 weeks into it, I just knew this was my niche. It was the best kept secret in nursing, and it was so rewarding. I loved working with families and children. So it was just where I wanted to be, and it's been almost 23 years now.
Wow. Sounds like you're trying to recruit some more staff there.
I am. I am. It's awesome.
Absolutely. Come join us.
Come join us. Well, you asked why I came. That's why I came.
How about you, Aisha? What brought you to
Absolutely. So I started my nursing career in emergency medicine, emergency nursing, in emergency departments in Baltimore City. And a lot of times you see, and while I love that, and it's always going to be part of me and close to my heart, you see people on the worst day of their life, right? And I just thought there has to be a way I can make a difference. Let me swim upstream a little bit and see if I can impact people's lives in community health and public health, and then at earlier ages to improve their lifelong health.
And the hours, right?
Yes, and the hours, and the hours, and my family. Yes, yes.
Right. So let's go to the new law on recreational cannabis, and how might this impact the schools?
Well, we're hoping it doesn't so much because recreational cannabis really is for adults, anyone 21 and years older. Okay. So now, as the law says, that there's a limited amount you can buy. It can't be used in public. It can't be used in schools, on federal property, in colleges. And as I said, this limited amount, it's like 1.5 ounces of flower or 12 ounces of consecrated, or like 750 of total. So we're really hoping it isn't, because it's not allowed. It's still prohibited in those places. So we're keeping our fingers crossed.
So do you think, based on the new law, that it will be easier for kids to get cannabis illegally? Laws are similar now, I guess, to alcohol. I know there's a little more restrictive nature with the new cannabis laws, but do you think kids will have the opportunity to get cannabis more readily?
Well, we're hoping not. You're not allowed to share it. We are encouraging parents to, just like other controlled substances, lock it up. Be careful. Don't use it in front of your children. Make sure that you have conversations with them on the dangers of it. You don't want it to be something that they have access to. Now, also with the sales, they're funny. What the law says too is they can't market it or sell it by schools, libraries, parks. So we're really, as we said, we're keeping our fingers crossed that it's something that they don't have access to. And we ask every parent and any user, please make sure it's locked up and kept away from children, because it can be very harmful and dangerous. Now, brains, there is a lot of research, and I have to say this as a disclosure, because it's still federally illegal. There's not a lot of research on the effects of the youth brain. You almost have to turn to other countries, which is something we started doing actually before this show to get ready. I was like, well, what studies is there? There's one in Australia and New Zealand that talks about its impact in decreasing students' graduation rates, ability to get degrees, developing substance use disorders, and even attempting suicide. So there's a lot of outside studies. It's just not in the United States. It's just because it's federally prohibited, which I have to say, it can't be used on federal property, which is all the mead schools. Well, not all of them, some of them on base. That's all federal property. So in colleges, I thought college kids can do it. They can't. You can't use it on universities, colleges. So it's interesting.
It'll be interesting. And just if you can expand, I know you talked a little bit about some of the dangers, but it's interesting that people think it's not harmful. Like I hear this all the time. It's like drinking a beer.
Yeah, and it's not. And it can be a gateway drug. It can lead to more, dangerous drugs. The THC levels are so much higher now than it was years ago. I hear people say that, well, I used it when I was in high school, and what's the big deal? It's different. It is not the same drug as it was. So the effects, there's so many different on their academics and on work performance, their behaviors, and really it's just such a gateway drug. And as we said, we don't know the effects yet of the brain. There are a lot of studies that show it has a lot of effects, but we'll wait and see what happens with the studies.
So Isha, what we talk about the dangers, what would be a reason that a student might start using marijuana? What are some reasons that kids might start dabbling into this stuff or getting involved in that?
So, peer pressure, one, but also coping mechanisms. So if they're dealing with things at home or at school or in their social groups, they could use it, start dabbling in it for those reasons.
Well, there's also a piece I was going to say with the co-occurring and mental health disorders. They found that there's a definite link of students who are suffering from mental health disorders and then also have substance use disorders because of it's like 60 to 75%. It's very, very high, as well as with the adult population.
Right.
So it is a coping, as Isha mentioned. It's a coping mechanism. You know, kind of helps them temporarily relieve their symptoms versus going and seeking help. So.
Yeah, and we see that a lot. I know in our fields of students that are coming into our office, they're either avoiding school, they're highly anxious, or they're depressed, and then they start to either, and I know we're going to talk a little bit about this, if it's not, some sort of substance abuse, then they'll start vaping. So it's really this cyclical circle. You see all these interrelated pieces, and I think, for parents, they don't always have all those pieces to put together. So I think that's critical that we're having this conversation to discuss those pieces. And so let's talk a little bit about vaping. It seems to be extremely prevalent in our youth. I know that my son, when he was in high school, and he only graduated 2 years ago, he would find vapes in the bathroom. They'd be in the toilet paper rolls. I've had conversations with my daughter who's in high school. So what is vaping, and what do you think has impacted? I do think that smoking cigarettes has gone down, but now we see this uptick in vaping. So just your thoughts.
Yeah, Isha, you want to cover that?
Sure, absolutely. So vaping is anytime, the simplest answer is anytime you're using a handheld electronic device to inhale a vapor, a mist, an aerosol into your lungs, that's vaping.
Okay.
So basically how the devices work is that they heat up the liquid, turn it into an aerosol, and then you're inhaling that through a mouthpiece into your lungs. And so anytime you're inhaling things into your lungs, they can be damaging, right? So what are the devices? They have many names. They could be Juuls, right? Juuls are vapes. E-cigarettes, vape pens, mods, anything. So any electronic nicotine delivering system, or sometimes you hear them called ENs. Those are all, they come by many names, but yes.
And so we talked a little bit about water, but water in itself, people think that's harmless. And what other than water, so can you talk to me? I know you talked a little bit about that.
Sure. So the substances that are most likely to be in the vaping liquid or the aerosol, usually it's nicotine.
Right.
In varying concentrations. So we know that nicotine is the harmful substance that's in cigarettes and other tobacco products, and the addictive substance that's in cigarettes and other products. Sometimes it can be cannabis or THC, so you can vape cannabis or THC, but usually it is nicotine. And then the other substances that are in there, yes, it's mixed with water, but it's not just this harmless water vapor that you're inhaling. There are other chemicals. So there's flavoring that has to happen. Once the liquid is heated up, it has to get turned into an aerosol. So there are other chemicals that turn it into an aerosol that are in there. Propylene, glycol, or vegetable glycerin. Those products turn it into an aerosol. And then there can be heavy metals in there like tin, nickel, things you just shouldn't be inhaling and that aren't safe.
Formaldehyde is even in there, yeah.
Formaldehyde, which we know that research says that causes cancer and lung disease. And there's also acetate in there that's linked to a very serious lung injury illness that comes from vaping.
Wow, that's...
So if kids are vaping, I don't know if you know the answer, but are most of them vaping nicotine, THC, or is there a combination of both? And then where do they, I imagine the THC obviously is illegal, so where do they get these things from? I mean, any idea?
I know that's vaping shops, I think online.
All around.
Yeah.
I will say the research says that 50% of the time it's nicotine.
Right.
And then the other time it's either THC alone or a mixture.
And they're high concentrations of nicotine, isn't it?
Yes.
Yeah, very high.
Okay, so it's like smoking. If you were going to compare it to cigarettes, is it like one vape per like 10 cigarettes or something like that? I remember reading.
Don't quote me, but yes, it's more potent than smoking one cigarette.
That's what I thought too. I thought it was 1 to like a pack almost of cigarettes. I mean, the concentration is very,
And so, then again, that's just evil, even making it more addictive to these younger students, these younger people. And the whole idea of aerosol, though, it's going from a solid, like a liquid to an aerosol. And that in of itself is the damage, not just the addictive qualities plus any other of these.
Right. It's the byproduct of that chemical reaction that's in the aerosol that you're also inhaling.
Okay, because I think people, like I say, they're just like, it's water.
Yeah, I know.
It's no big deal, and I think that we have to be cautious about that.
And I will, to piggyback on what you were saying, we are seeing it in high schools, but we're also seeing it in middle school as well. So
that's a big part,
population. Yeah.
So it's really important for parents and families and caregivers to be, I think, mindful of what they're doing around their kids or having their kids having access to, because it's really access. We talk about access in homes and keeping kids safe from like old prescription medicine that's not, thrown out or handled or dropped off at the health department. Just with all those things that students, because their brains are still developing and they're very impulsive.
Very impulsive.
And we know that, and when they're struggling with a mental health disorder, that comorbidity piece can be very tricky for families. So just being mindful of that.
Yeah, watch out for products around the house. If you see something, you get an idea that, maybe they started when you didn't know. You know, there are a lot of things like that you look at.
It is. It can be very tricky. We'll be right back after this short break. Stay tuned.
Welcome back to At Your Service. We will be continuing our conversation with Karen Siska-Creel and Isha Alston from the Department of Health and School Health, and we've been talking about cannabis and vaping. So thank you all for continuing this very informative conversation. And we're going to start our first question with something we visited in the first part of the show, but tying back to the connection between substance use and mental health, can you talk to us more about that and how those two can be connected?
Absolutely. As I mentioned earlier, the estimated rates of co-occurring mental health disorders with children, with adolescents, and substance use disorder ranges between 60 and 75%. Now, youths who have experienced a major depression event, they're like twice as likely to use alcohol or substance use drugs. In adults, it's surprising. 1 out of 4 adults with a mental health illness also have a substance use disorder. And the mental health disorders that kind of more highly related to and connected to substance use disorders are like depression, anxiety, personality disorders, even schizophrenia. Oh, wow. So there is definitely documented correlation between mental health and substance use disorders.
Goodness. Yeah, and so if you see your, for the parents out there, what are some of the signs that their child could be using cannabis or vaping?
I think the first thing we'll notice as parents is a change in our child's behavior. Maybe change in friends. Maybe they start getting in trouble. Their grades start to drop. All of a sudden they need money. Their behavior is a little off. Their appetite could change. Their sleeping habits could change. They also look a little different, lose weight. Their eyes get red and glassy. They smell a little different. You could even have nosebleeds. They could be really thirsty. So there are a lot of different signs and symptoms. They also, I was reading, it was an interesting study that said if you really want to know as a parent, go on social media, look on your child's social media accounts. They like to brag about it and post it. So even though you're a parent, you want to protect their privacy, look, because a lot of times they brag on those sites what they're doing. So it's a good way to kind of check. But really, my best advice is anything that you see different in your child's behavior, start looking into it and see what's going on in their life, because something could be, they're vaping, as you said, it could be cannabis, could be a mental health disorder. I mean, you just don't know. So I think being involved and watching is the best thing.
Great. And it's always tricky. So let's say you have some suspicions, right? And so as a parent, how do you approach your child if you suspect that they are using any kind of drugs or alcohol? What are some tips that you would give to parents without, because the goal, I think, is how do you do it without pushing them further away, because you obviously want to help them.
It's tricky.
Absolutely.
I think having an honest conversation, open and discuss what's going on and talk about their behaviors and what you're seeing and see if they'll open up and talk to you about it.
I was going to say, that's a great question. I would like to back that up just a little bit, because those conversations and discussions with your child should start early.
Good point.
Have age-appropriate, developmentally appropriate conversations starting at a very young age in non-threatening ways, in a safe environment. When you're driving in the car, going somewhere, or when you guys are sitting down for dinner, start a conversation. It's important to have those conversations, but then also continue to talk to them as they get older. Share your set expectations in your family, right? Set family rules. Be clear about what your views are on substance use, on nicotine or tobacco use, and then. So once you are having those conversations, if you notice something, then you want to encourage discussion, right? You want to ask open-ended questions. You want to be patient with them and be ready to listen and hear what they have to say. Maybe ask them open-ended questions like, tell me about what made you start to look into this as an option. And then seek help. If you need help having conversations or for help, the CDC has fact sheets for parents. TobaccoFreeKids.org has fact sheets for parents. Also, the Maryland Department of Health and our Anne Arundel County Department of Health and the CDC have information about how to talk to your kids. So
it's something you brought up too. I think that's an excellent point about having these conversations early. And I know something we do in our health curriculum is we don't, I think back, when I was in school, it was more about these are drugs, drugs aren't good. It's more the factual stuff, right? But now what they teach is more refusal skills and,
Right.
and role playing.
Advocation.
If I get peer pressure, how do I handle that situation? I don't know if you have any advice for parents in regard to that.
No, absolutely. You want to role play scenarios with your family and with your children. Have an avoidance plan. So if you're out and you're hanging with your friends and you're offered something, what are you going to say? How are you going to avoid that situation? How are you going to make the best choice for you? Have an exit plan. So a lot of families have a code word. If your child texts you the code word, that's your alert. They need you. They want an out from that situation.
Yep.
So it's good to have a plan.
That's a great. I mean, even I think, and not just for that, for like
Anything.
if they're out with kids that are drinking and they need a ride, like all kinds of peer situations. I think it's good to have those role playing and those open lines of communication, and to your point, early, because sometimes it's too late when they get older and you haven't developed those safe conversation, safe spaces. So.
Yeah, I used to use a code word with my son. Just text
I
me
do
this
too.
word. I think it was apricot or something, and I knew that meant okay. I know what's going on. You know?
Right, and it was like, and the other thing, and I do have a code word for my high school student, and it's like, I'm not going to drill you.
Yeah.
This means that they are coming to you
Yes.
as their
for help.
safety,
Judgment free.
and it's like, just get here and we'll pick you up. Like, and I always say to my children, I'll take the fall for you.
Yeah.
Like
Me
my
too.
parents will. Like my
sure.
parents were pretty strong. But I was always like, there is no way, because my parents, I don't want to be grounded for 6 months or whatever. But I was like, you know, that could be your first line of refusal right there. Like, have you met my mother?
Yeah,
You know
right,
what I
right,
mean?
right.
Have you met my father?
Exactly.
Yeah.
Not in my house. So
Absolutely.
there's a lot of things you can do. But I totally agree. I think developmentally, having those conversations starting in elementary school.
Well, I also
Absolutely.
I also think right now, drugs are different than they were, say, 30 years ago. So can you all
Yes.
talk about
yeah.
just the role that fentanyl plays, even with cannabis use, but the role that fentanyl plays in terms of drugs and drugs that kids may have access to anywhere?
Yeah, I think what is so different about marijuana or cannabis from years ago, is now it is so synthetic and there's so many chemicals added to it that wasn't prevalent years ago. I mean, now we've even had cases where fentanyl has been added to cannabis,
Right.
and they bought it, the guy who purchased it, they had no idea that it was. I know several years ago, Anne Arundel County had our first fatality where fentanyl was in cannabis and the user had no idea it was in there. And it was
Right.
fatal and they died. So there are so many things that can be laced into when you buy it off the street. You have no idea what you're getting.
Wow.
And the combination of its strength. So you really have to be careful.
Yeah, that's it's a crying shame, because like I said, people keep going back to their 20 years ago. I hear it all the time.
Yeah.
And it's like, it's a new day. It's a completely new day. It's not the same. Stop comparing. 100%.
Yeah.
So, yeah, most
dangerous.
definitely.
So let's talk about some programs. So if parents, they've had conversations with their kids and their kids are struggling with substance use, and the parents want to get them some help, or they want to get some help, hopefully. What are some programs that the health department has to support children and adolescents who may be going through this struggle?
Well, the first thing I'll brag about is our STAR program, which is screening teens to access recovery. And it's great. Any child, any student in middle school or high school can go into the health room, mention STAR program, and they will be connected virtually with a licensed therapist. Now, in high school, it's through the health department, but in middle school, it's actually through Thrive, which is a contract that you guys have with the company Thrive. And they also, you guys have a substance use prevention and intervention team. So any student, or parent can really students can contact a counselor or school nurse and get connected to services. And that's the advantage of STAR, is they come in, they get connected right away and screened by a licensed therapist, and they can get plugged into services if they need it, which is a great program. Now, the health department also has some additional programs. They have adolescent and family services, which have it's easy. You can just look for the number online. It's just a 222 number. I think it's 675 6785 or something like that. Yeah,
Yep,
6785. And then there's a youth and young peer support group program that the health department has too. Again, it's a 222 number. It's 7076. So there's some great programs available that students and parents can access. And as Isha mentioned, even an online number. So
there are a ton
there's
of
some great
online resources.
Yeah.
There's also smartphone apps now.
Oh, yeah.
You know, because when you do suspect or you find out that your child is vaping or using cannabis, you want to support them in the quitting. So there are also resources online and smartphone apps that will walk you through the process, but you should also reach out to a child therapist, like mentioned in these programs, for an evaluation and resources. And also, don't forget about your primary care or your child's pediatrician.
Makes sense.
And there's a crisis line too, isn't there?
Yes, if you have serious concerns about your child and their safety, there's also the Anne Arundel County Crisis Response.
I think it's amazing that we have all these programs. It's just how to access those programs. And so definitely having parents, they can call the school, they can call the health department to see which one fits them. I think with STARS, it's the students
that come in. You know, and
Mm-hmm.
it's funny because when we first started that, we were curious to see how many students would come in and would realize at a young age that they needed help. And in high school, you know, we launched it March of 2018. It was so between that and May, June, there were like 6 kids came in. I think one child came in like 48 hours after we launched the program.
Wow.
So it was great. And since then, since we launched it in middle school last year, we saw 2 students. And then we also saw in high school 17 students. So I think in total we've seen about 32 students, which is awesome. These are 32 students who were screened and were plugged into services if they needed it, which is wonderful. And understand too, that was during COVID.
I know, that's what I was
So where there was
say.
no
Holy
school.
cow.
So, you know, yeah, so we're very proud of that. And as you said, you have several different avenues.
Right.
There's a health department, pediatrician, crisis,
Right.
or the student themselves just can come in and ask for help.
I know, and I like the idea because students, that means they are taking ownership. They recognize even at a young age, okay, this is a problem, right? And so they're able to reach out. And I always find that to be the stronger way for kids, because you know some kids are in denial or they rebel. And I also think for parents, if they're watching this, you know, show, or caregivers, that even if you have a question, you can also reach out for information. Like, I'm not sure if this is what I'm seeing or this makes sense, but I know that there are people like the school health nurse, the school counselor, like trying to put the big picture together, because sometimes you see it in fragments and you're like, wait a second, so this is a great opportunity for them.
Yeah,
So I just think that we have some great things happening in Anne Arundel County and that we're proud of them, and we're trying to really support our students and families. So thank you very much for all the work that you guys do, and I appreciate you being here today on At Your Service as our guests.
Well,
Thanks for having us.
Thanks for having us and your collaboration. I think together, you know, the public schools and the health department are really a great team to address this issue and help the children in our county.
I agree too. So thank you for joining us today on At Your Service. See you next time.